In this video, I'm going to talk about behaviour testing and pregnancy in camelids. Behaviour testing, also called spitting off, is when the female is introduced to the male to see how she behaves. Behaviour testing can be used as a preliminary diagnosis of pregnancy, and it's going to be correct about 85% of the time. Because 15% of the time it's going to be incorrect, it's important to check that females are pregnant by using another form of pregnancy diagnosis. And the best tool for this is ultrasound, because you can actually see the fetus, developing fetus inside of the uterus. So what's happening when behaviour testing is wrong? Well, you have to know some basic camelid reproductive physiology to understand this. When a llama or alpaca is bred, if there is a dominant follicle on the ovary, it will ovulate and a structure called the corpus luteum, or CL for short, forms in its place. The CL produces a hormone called progesterone, and that is responsible for maintaining pregnancy throughout pregnancy in camelids. Therefore, throughout pregnancy, progesterone concentrations are increased, and a female will be behaviourally non-receptive and spit off. After ovulation, it takes 3 to 5 days for progesterone concentrations to increase. 7 days after breeding, any female that is ovulated will have a high progesterone concentration and be spitting off. In some instances, if ovulation results in conception, then progesterone concentrations remain high, while if conception does not occur, progesterone concentrations fall by around day 10 to 11 and are at baseline again by day 14, at the second spit-off. These females will become receptive again and sit for the male to breed at that second spit-off. Occasionally, the CL does not regress as it should and is retained. In these non-pregnant females, the CL continues to make them behave in a non-receptive manner, despite not being pregnant. This is the case in about 15% of behaviourally non-receptive females. This is why it's really important to have non-pregnancy or pregnancy confirmed using ultrasound. Depending on your vet, their equipment and your handling skills, this can be done after 30 days or later. If you don't confirm pregnancy by ultrasound, you could end up waiting for a birth that will never come and end up wasting 2 years of breeding life. If you confirm pregnancy by ultrasound, you can be certain of the diagnosis. Females that are not pregnant can be rebred, and this results in less wasted time with females open. It's also a good idea to reconfirm pregnancy again at 8 months, at which point you need to increase nutritional provision for females entering the last few months of pregnancy. And any non-pregnant females can be allocated for early rebreeding in the spring. If a female is behaviourally non-receptive but not pregnant on ultrasound, we can give her hormones to cause luteolysis. That is, to make the CL go away. However, it is vital to ensure that the female is not pregnant before doing this, because it will obviously terminate any pregnancy too. This is best by visualising their non-pregnant uterus on rectal ultrasound. This can be done by your vet. It is much easier to miss a pregnancy on transabdominal ultrasound and be incorrect, but you cannot mistake a non-pregnant uterus. Unfortunately, this 5-month fetus was aborted following a 2-dose course of cloprostenol or estromate when a vet had incorrectly diagnosed non-pregnancy on transabdominal ultrasound. The diagnosis had been made in the 2nd month, but drugs were not given until the 5th month. If you or your vet are uncertain of the diagnosis or uncomfortable performing rectal ultrasound, it is probably better to recheck the diagnosis a couple of weeks later to be sure, or to find a vet with more experience to confirm the diagnosis prior to giving luteolytic medicines. If you want to learn more about camelid reproduction, anything else about the care of camelids, or would like to have a case referred to us, please follow us on Facebook and visit our website at www.ukalpacavet.com. Thanks for watching.